Morning, supervisors. Good morning, community. Matt Willis, Public Health Officer, with a COVID-19 update for today, March 16th. Alvaro, if I could have my slides, please. Next slide. So this shows our summary of COVID-19 pandemic response thus far. This also happens to coincide with the 1-year anniversary of the issuing of our shelter-in-place order on March 16th, 2020. We've had a total of 11,209 cases. Right now, there are 207 active cases. That number continues to decline as our transmission rates in our community decline. We have had a total of 170 deaths as a community since the start of this pandemic. I'll note that each day, deaths to COVID-19 are reportable directly to the public health officer, usually by telephone. And I'm happy to say that this is the first week where I have had no such calls. We've had no new deaths in Marin County in the past week. And that's the first time I can remember that happening since last spring. And we've tested nearly 400,000 residents. Next slide, please. So as our transmission rates decrease, so are we able to move through the tiers into less restrictive policies. We are currently in the red tier, as is the majority of the state now, with the governor changing the criteria based on success in vaccination rates statewide, being able to liberalize the policies. More counties are now in the red tier. We are now in our first week of orange tier numbers. Again, you recall that we need 2 weeks of success in the less restrictive tier before we are moved into that tier. So we anticipate that we'll be moving into the orange tier next week. Next, please. So as our rates continue to decline, we do anticipate moving into an orange tier on March 24th. And just to remind us and prepare for what that will mean, retail and grocery stores will be able to be open to 100% indoor capacity, indoor dining at 50%, movie theaters and museums also 50%, houses of worship 50%, cultural ceremonies, weddings and funerals also 50%, gyms can open to 25%, and indoor pools are now newly able to open. Breweries and wineries that don't serve food will be 25%. Bars would be able to open outdoors, and office space that are associated with non-essential work are now able to be opened, although we still recommend wherever possible for people to work remotely. And then for higher education, lecture halls are able to open at 50% capacity. The earliest potential movement into the yellow tier would be April 14th if our case rates continue to decline. And that's because as a state policy, we're required to be in any one tier for at least 3 weeks before we move into the next less restrictive tier. Next, please. So now I'll move to our highest priority right now, which is our vaccine plan. This shows the number of Marin County. Thus far, we have 32% now of our population as a whole that has been vaccinated. And this represents the entire population of 260,000. Stepping back, you remember that right now only residents age 16 and above are eligible to be vaccinated because the vaccines have not been authorized for young people. So that changes the number to about 210,000 residents who are actually adults in Marin County. So it means about 40% of our Marin County adults have been vaccinated with at least 1 dose. So we're making rapid progress. Next, please. And then this just shows our rates in comparison to other California counties in terms of our vaccine distribution. Next, please. With the highest rates. This is our breaking it down by age, shows that residents above age 65, about 75% have been vaccinated, and residents above age 75, about 85% have been vaccinated now, with an increasing fraction of those having received both doses and being fully immunized. Next, please. And then, of course, as part of our commitment to health equity and racial equity in every element of public health, including our pandemic response and in our vaccination plan, we track very closely the racial differences potentially in our vaccine distribution. And this shows that among our residents age 65 plus, about the same rate of our Latinx residents as our white non-Hispanic residents have been vaccinated. Only 54% of our Black residents above age 65 have been vaccinated, which is beneath the rate for other racial groups, and signifies likely a combination of known barriers to access and increasing rate of vaccine hesitancy in that community. Next, please. And to get to make sure that every community has equal access to the vaccine and also opportunities for education and outreach, we are launching an outreach campaign called Get Vaccinated Marin. These will start being more visible to our community around bus stops. This will be on Golden Gate Transit. This will be in the Marin IJ, and digital display and social media samples, both in English and Spanish. We've reached a point now where we're anticipating that the supply of vaccine will continue such that people who are seeking vaccine will be able to more easily access vaccine, and we'll start reaching into that population that may be more hesitant. Up to this point, the supply has been so limited that hesitancy has not been as much of an issue for us. In fact, it's been the opposite. There are many more people who have been eager to get vaccinated than have been able to be vaccinated thus far. Next, please. And just to remember that we are now looking at 3 effective vaccines in our toolkit. It's been a huge asset for us to have another vaccine. So in addition to the Pfizer and Moderna, which were the first 2 that received the emergency use authorization, the Janssen product now, the Johnson & Johnson product, is now being used in Marin County and across the region and the nation. It is proving to be a real asset for us in terms of it's only 1 dose, so we don't have to get people back for the second dose. The safety profile is the same as the others, very safe. The effectiveness in terms of preventing death is the same. No one in the studies with the Janssen product died from COVID-19. Also highly effective at preventing severe illness, which is obviously what we're most concerned about, is severe illness and death. This happens to be the product that I myself took last week. It was the Janssen product, because I feel confident in its safety and efficacy. And it's right now, when we offer it in combination with others, Kaiser and other places where they're offering the Janssen product and others, as many people are seeking this as others. In fact, it may be increasingly popular relative to the other formulations, which is good news for us because we're looking at 100 million doses coming down the pike of the Janssen product nationally over the next few weeks. Next, please. And then just wanted to offer the global perspective on our vaccine plan as we look at about 1/3 of our residents being vaccinated, remembering that we are privileged as citizens of the United States in terms of just having a higher fraction of the total global distribution. About 21% of the citizens of the United States have been vaccinated who are eligible. In Marin, again, 33%. But stepping back, the global vaccination rate is 3%. And this pandemic is not going to be over until everyone in the world has had access to the vaccine. And if there are pockets where there are very low vaccination rates, the risk for mutations that would potentially harm all of us and cause a resurgence or a 4th wave in the pandemic remains high. So we're privileged to have access to the vaccine. We will be moving as quickly as we can through our community. But we also need to remember that, especially with regards to our own personal behavior in terms of travel, until the globe itself is better protected, it is not safe to travel internationally. Next, please. This is how people can get registered to be vaccinated. So this My Turn is the increasingly common state platform for registering for appointments. Some clinics and vaccination sites are accessible only through My Turn, and others are not. So the message is that we want all of our residents to go ahead and register in My Turn. It's the state vaccination platform, and that will alert you to vaccine sites that may be available within Marin that are tied to My Turn, and also outside of Marin County, like the Moscone Center, the FEMA site in Alameda County, and other sites outside of Marin. And at the same time, next slide, please. We'd like our residents to register with our own county vaccine interest form, which is available on our website at getvaccinated.marin.org. And that's the best way to have to make sure that you're really best notified about any options, both within Marin County and outside of Marin County. Next, please. And then again, for those that are having trouble accessing vaccines through those online portals, we have a vaccine appointment phone support, 833-641-1988. So if you or anyone you know is having trouble, who is eligible, is having trouble accessing online registration for vaccines, not necessarily someone who's frustrated not to find visits, because that will be not uncommon, unfortunately, until we have more supplies, but someone who is actually technically not able to navigate through that process, we'd like people to go ahead and call. Someone will be able to walk them through the process with a real life person. And there's an analogous phone support for My Turn as well. Next, please. So just want to acknowledge that we are at the 1-year anniversary of the Bay Area stay-at-home order. This was March 16th, 2020. And I remember traveling to Santa Clara to join the health officers of the other 6 jurisdictions across the Bay Area that came together for the nation's first stay-at-home order as we started to see rapid surges in cases of COVID-19 in the Bay Area. And I was just reading through the language of this order, and a few things struck me. One was that it was listed as a stay-at-home order for 3 weeks. And here we are, a year later. And that we were still obviously just trying to educate ourselves and our communities about what are the ways that we prevent transmission at the community level. And this third paragraph, scientific evidence shows social distancing is one of the most effective tools for preventing transmission of a communicable disease. The concept of social distance, just those terms were new to us. Again, we weren't at that time even recommending masks. We didn't know that this was one of the most important and has emerged as probably the single most important public health tool available to us. And there we are standing, the health officers, standing indoors, none of us wearing masks, and shows the need for for the humility I think we've all realized as we've grown and learned through this experience, and how effective the strategies that we finally learned are in terms of actually preventing transmission. Next, please. And this is just some of the other by way of review. My wife is a psychiatrist, and she reminds me that this is it's not time to process and really process grief and loss when you're in the middle of it, and we're not out of the woods yet. So we will have a time to look back on this together more wholly and more meaningfully, because again, we're not out of the woods. But I also want to just take this chance to look back and thank our staff for all the amazing work that they've done over the past year to support our community. Marin has had a relatively successful response to the COVID-19 pandemic. And it's because of the behavior of our community members, it's the support that we've received from our hospital partners across the community, and also all of the work of our teams. And this is just some of the summary of that. These are the funds that have been distributed to our residents who lost work, lost access to daily wages because of quarantine or isolation orders. Over $2 million distributed to over 2,000 people. And you can see there where the bars correspond to the surges in cases. The amount of money that we've been spending to support people through disaster service payments, it tracks almost exactly with the surges in cases, with an average payment of over $1,000 per case. Next, please. And then this is just the call call centers, the staff that have been responding to communities' needs all the way along. Over 23,973 calls, 23,000 emails responded to. 109 videos produced, 14 virtual town hall events, 307 issues of the daily status updates, just a lot of communication, direct communication with our community all along the way. And again, this has taken really an all hands on deck effort by everyone within public health and Marin County government. Next, please. And this is just another sign of hope for us. Remembering that each day, more than 100 times more Marin residents are being vaccinated than are being infected with COVID-19. Our infection rates continue to decline, our vaccination rates continue to increase, and those are in fact the ingredients of moving out of the pandemic experience for us together. We're not there yet. It's going to be at least 2 more months where we're going to need to be staying the course, but this is clear hope for the future. Next, please. So in summary, COVID-19 transmission continues to decline. We're heading towards the orange tier. Reopening brings new risk and new responsibility. We've been here before. We know how to do this. Our vaccinations may remain the highest priority for us, and we're continuing to vaccinate our residents as quickly as we can in partnership with all of our healthcare partners. There are many unknowns regarding the pandemic path, globally and locally, so we need to stay the course. Next, please. And that concludes my presentation. Thank you.
Thank you, Dr. Willis. Board members, questions? Supervisor Conley.
Thank you, and thank you, Dr. Willis. As always, really wanted to commend you and your team and indicate how proud we are of the response you have overseen over the past year, and appreciate your summary of what has occurred. And what you recognized early and I think acted on effectively was a recognition of disparities in how this pandemic was affecting our community early on in testing and just overall healthcare. As we now fully engage in the vaccination stage, and more good news that you're reporting on that front, so much appreciated. Wanted to ensure, as I know you are, that we continue that priority and focus in the distribution of the vaccine. You reported today on our different communities and vaccination rates and some gaps that I know we will be addressing. But hearkening back, for example, to some of the strategies we used on testing, was hoping you could comment in the vaccine context. We know, for example, in the canal, people are living in overcrowded conditions. There are a disproportionate percent of the population there that are performing essential work. For example, throughout this pandemic, folks have been continuing in construction, gardening, landscaping. So wondering if you can comment on how we are approaching that. I know it has been reported on recently to some extent as well, as we tackle the vaccine stage in addressing some of those populations.
Yes, I mean, it's been obviously one of the main lessons of the pandemic across the world and in Marin, that disparities have been revealed in every way. It sort of pressure tested our society in some ways, and the cracks that we anticipated were revealed in terms of equity. And in Marin County, a vast majority of our cases were disproportionately impacted, especially our Latinx residents. At one point in August, 90% of our cases were among Latinx residents, make up 16% of our population. We had addressed that through partnership. The asset we have in Marin County is that there's very strong community leadership and grassroots efforts in all of our communities. And so really just linking directly with them and kind of getting out of the way as much as we can and saying, how should we approach this? What would be the best way for us to ensure equity in our response? So in the canal, for example, working with Canal Alliance, the Canal Welcome Center, Marin Community Clinics, which is the primary, federal qualified health center working in that neighborhood, faith-based organizations. The rails were laid, early on for that kind of partnership. And those are the same rails that we're traveling on now in terms of our vaccine distribution plan. And that's the reason we've been able to, we actually had higher vaccination rates among our Latinx residents than our white residents in our age 65 plus, partly through those partnerships. It's something we need to be tracking very closely. I think the other lesson we've learned is that data is essential. When we're trying to promote equity, we need to measure, because anyone can say anything they want in terms of their commitment to equity, but it is what it is. At the end of the day, the disparities are revealed through numbers, and that's one of the reasons I continuously bring data back to the board and to our community, because it's about performance, and we want to make sure that we're actually performing well for our equity communities. And when we're performing well, we'll say that, and when we're not, we'll also say that. So we have progress to make in our vaccine distribution plan. We anticipated that there would be barriers for some groups, and we're working again with those grassroots organizations to really reach every community to get people in for vaccines.
Great. Can you also give an update on where things stand with vaccination of our teachers and other education staff? I know that's been a priority.
Yeah, I think we're done. I mean, for those that were wanted to be vaccinated, we opened 2 of our Super Saturdays. Last Saturday, we had our highest number of people vaccinated in any one event, since that KO polio day in 1962. We had, I think, 2,300 of our educators were vaccinated at the Marin Center on one day. That was the second day we dedicated to that. So between those two, over 4,000 of our educators were vaccinated at the Marin Center. And we reached a point where there were no more educators seeking vaccination that didn't have appointments. So I think we're 9,000 total in that sector in Marin County, and we vaccinated close to that number. So if there are any teachers out there that want to get vaccinated, the door remains open. But we're pretty confident we reached our goal of getting everyone their first dose before March 15th.
And that includes others who also work in the school environment, including parent volunteers. And
that we cast the net broadly for that sector.
Right. Final area, a new study found no significant difference between 6 feet of physical distancing versus 3 feet of physical distancing. Wondering if you are aware of that study, and what can you tell us about the study and any conversations at the state level? Will it have any impacts on sectors like schools, transportation, and others?
Yeah, we're hoping that evidence will start, finding its way into policy. Right now, we are at the, we're following the state policies with regards to the distancing requirements in school settings and others. It's important to remember that the 6 feet, first of all, there's no magic moment in terms of distance. It's a continuum. World Health Organization has used 1 meter, which is about 3 feet, as their number, and those, this was all also as we saw in those pictures from 1 year ago. This is before masking, before the critical role of ventilation and masking was clearer. So it's looking like, and the study that you mentioned shows that if people are covering their faces, children are covering their faces in well-ventilated space, the risk between 3 feet and 6 feet is virtually the same. And so if we're able to go in Marin County, we saw evidence that there was not a big difference between 4 feet and 6 feet at that time. This is in June of last year when we first put our policies for our schools. So we actually went to a 4-foot policy for our schools in Marin back in June. And that helped allow our schools to reopen. since then, we've seen only 11 cases of transmission of COVID-19 within a school setting with over 1.5 million accumulated student days. So I think the evidence has been clear that that was a safe strategy in terms of the distance at 4 feet. And so we're hoping that we can move to less than 4 feet. 3.5 feet would allow our high schools to open full-time, all classrooms. They can't manage exactly with 4 feet. The problem there is the state, if we go beneath 4 feet, there's a new set of requirements that would need to be put in place by state policy, including more frequent testing that represents in itself a barrier to moving to less than 4 feet. So we're hoping that science that you're referring to, Supervisor Connolly, will find its way into state policies that will allow us to move to less than 4 feet.
Thank you.
Other questions, board members? Okay, I think we're going to hear from Dan Eilerman now.